Welcome to the Health Headliner podcast by Tudu Digital. Our content is informational only and not medical advice. Please consult your provider. Now, let's dive into today's headlines.
Okay, let's unpack this. Imagine a world where feeling persistently down, maybe lacking energy, or struggling with sleep, even if it's not, full-blown depression, was actually easily addressable.
Right, because globally, it's something like, 11% of adults experience these kinds of subthreshold depressive symptoms?
Exactly. And they're often overlooked, but they really do impact things like social functioning, quality of life.
Oh, definitely. And they even contribute to economic losses, sometimes on par with major depression, which is pretty surprising.
It really is. So here's the intriguing question we're diving into.
Yeah.
What if the very device we sometimes blame for our stress, our smartphone, could actually become a tool for mental well-being?
That's precisely what this fascinating new study out of Kyoto University explored. It was just published in Nature Medicine.
Yeah, a really interesting piece of research. They looked at whether a smartphone app, one designed to deliver cognitive behavioral therapy skills, could actually help adults with these subthreshold symptoms.
Mhm.
So for this deep dive, we're going to zero in on the findings from that scientific paper. We've also got a health news article reporting on it, just to give us a slightly broader view.
A good idea.
And our goal for you listening today is to really understand how this app works, what the study actually found about, how well it works, and what the implications might be for making mental health support, more accessible in your everyday life.
And just to be clear up front, if we hit any scientific or technical terms, we'll spell them out. No acronyms, no jargon, just making sure it's easy for everyone to follow along.
Perfect. So let's dive into the study itself. What was the main purpose here?
Well, the researchers at Kyoto University had a pretty clear goal. They wanted to develop and then really rigorously test a smartphone app teaching these core cognitive behavioral therapy skills.
Okay.
The main aim was to see if using this app could improve not just those subthreshold depression symptoms, but also anxiety and insomnia, which often go hand in hand.
Right, they often do.
And importantly, they also wanted to figure out how effective each individual cognitive behavioral therapy skill was, not just the whole package.
Oh, that's interesting. So breaking it down. And this wasn't just a small test run, was it?
No, not at all. It was a large-scale study. They conducted an individually randomized controlled trial, which is kind of the gold standard for this type of research.
How many people?
They involved 3,936 adults in Japan, all experiencing subthreshold depression. Big group.
Wow, yeah.
And these participants were randomly put into one of 12 different groups. So some got the app with different combinations of skills. Others were in various control groups for comparison.
12 groups. Okay, we'll need to unpack that. What was the app called and what skills did it teach?
The app itself is called Resilient, and it was designed to teach 5 core fundamental cognitive behavioral therapy skills.
Okay, what were they?
Right. So first, there was behavioral activation. That's basically about increasing engagement in pleasant or meaningful activities.
It makes sense. Get people doing things they enjoy.
Exactly. Then cognitive restructuring, that's about identifying and correcting those negative, unhelpful thought patterns.
The classic CBT technique.
Third was problem solving, teaching a structured way to tackle problems that feel overwhelming.
Useful skill for anyone, really.
Definitely. Fourth was assertion training, helping people express their needs and wishes effectively, but without, hurting others, respectfully.
Okay. And the fifth?
And fifth was behavior therapy for insomnia. So specific evidence-based techniques to improve sleep.
Got it. 5 key skills delivered via an app. Now, you mentioned 12 groups and a complex design.
Yeah, this is where it gets quite clever, actually. They used what's called a master protocol. Think of it like running 4 related studies or mini experiments all at the same time within the main study.
4 at once.
Sort of, yeah. It uses specific design for 2x2 factorial trials, which allowed them to efficiently test the effectiveness of these 5 skills, both on their own and in different combinations.
Okay, so a really efficient way to test lots of variations.
Exactly. And behavioral activation, that first skill, was seen as particularly important. So it was kind of a cornerstone included across all 4 of those mini trials.
So this master protocol idea is basically about being smart with the research design to get more answers from one big study.
You got it. It's like a shortcut to testing multiple ideas thoroughly and seeing what works best or what combinations work best.
Okay. And critical to any study like this, how do they compare the app's effectiveness? What were the control groups?
Right, good question. They had 3 different types of control groups to compare against.
Okay.
One was a delayed treatment group, basically a waiting list. They'd get the app later.
Standard practice.
Yep. Another group used a different app, but this one just provided general health information stuff on exercise, nutrition, oral health.
Ah, so to see if any sort of positive health app made a difference.
Precisely, an active control.
Yeah.
And the third control group used a very simple self-check application. Participants just monitored their mood once a week using that standard questionnaire, the Patient Health Questionnaire 9.
So just tracking mood to see if self-monitoring itself had an effect.
Exactly, just to see if increased awareness changed anything.
Okay, so people use the main resilient app or one of these control conditions for how long?
The main intervention period was 6 weeks, but then crucially, they followed everyone up for 6 months to see if any effects lasted.
And did people actually use the app? Adherence can be tricky with apps.
It really can, but here it was surprisingly high, 84% adherence to using the application.
That's pretty good.
It's very good. And the follow-up rate was also excellent. They managed to keep track of 97% of participants at that crucial 6-week mark.
Wow. So high engagement. How do they actually measure if it worked? What was the main outcome?
They used a statistical approach called mixed model repeated measures analysis. It sounds complicated, but basically it lets you properly compare the changes in scores over time between all those different groups, adjusting for baseline differences. And the primary outcome, the main thing they were looking at, was the change in the severity of depressive symptoms. They measured this using the Patient Health Questionnaire 9 score, comparing the score at the start to the score at week 6.
Right, the PHQ-9 score change after 6 weeks. Got it. Okay, so we've dug into the how of the study. Let's pivot to the really important part for you listening. What did they actually find? What does it all mean?
Well, the headline finding is pretty striking. All 5 of those cognitive behavioral therapy skills, whether delivered alone or in any combination via the app, were significantly more effective at reducing depressive symptoms after 6 weeks compared to all 3 of the control conditions.
All 3, including the Health Info app and the mood tracking.
Yep, compared to the waiting list, the Health Info app, and the self-check app. This strongly suggests the specific therapy skills in the Resilient app were driving the benefit.
Okay, that's a big deal. And how big was the effect?
Get this, the researchers reported that the effect sizes, basically the magnitude of the improvement for the app's interventions, were actually comparable to the effects often seen with antidepressant medications for similar populations.
Wow. Okay, pause there. Comparable to antidepressants. That's potentially huge, isn't it? The device in your pocket being potentially as impactful as medication for many people with these symptoms.
It really is. It speaks volumes about accessibility and potential reach.
Absolutely. Did the benefits stop at depression symptoms? You mentioned anxiety and insomnia earlier.
Good question. And no, they didn't. The benefits extended beyond depression. Participants also showed significant improvements in anxiety symptoms. They measured that using the Generalized Anxiety Disorder 7 scale, the GAD-7.
Okay.
And also improvements in insomnia measured by the Insomnia Severity Index, so broader positive effects.
Were certain skills better for anxiety or sleep?
Interestingly, yes. They found that behavioral activation getting active and the behavior therapy for insomnia were particularly effective for reducing anxiety symptoms.
Interesting link between activity, sleep, and anxiety.
Definitely. And for sleep itself, unsurprisingly, the behavior therapy for insomnia was most effective, either on its own or when combined with behavioral activation.
So some specificity there. What about long-term? Did the effects last beyond those initial 6 weeks?
Yes, and this is perhaps one of the most encouraging findings. The positive effects on depressive symptoms were maintained for up to 26 weeks. That's 6 months, remember.
Even after the main 6-week intervention period.
Exactly. Even with reduced app usage after those first 6 weeks. This really suggests that participants weren't just getting a temporary boost. They seem to have genuinely learned the skills and continued applying them.
That implies real skill acquisition, not just like a placebo effect from using an app.
Precisely. And another interesting long-term finding, over that full 26-week period, learning 2 skills generally turned out to be more beneficial than learning just a single skill.
Okay. So maybe a bit more robust over time if you learned a couple of different strategies.
It seems that way, yes. The combination seemed to offer more enduring benefits.
So the big picture implication here feels like potential for really personalized mental health support. tailoring skills to what someone actually needs.
Absolutely. These findings really open the door to that possibility. Imagine getting specific cognitive behavioral therapy skills delivered via an app tailored to your particular challenges, whether it's low mood, worry, sleep problems, or a combination.
Yeah.
And the researchers are already thinking along these lines. They mentioned they're now preparing a platform for even longer-term interventions, like 12 months, designed to offer this kind of personalized support.
That's exciting. It really underscores the potential of just leveraging the technology most of us already have.
It does. It highlights how we might use readily available smartphone tech to tackle this huge global mental health challenge, making evidence-based therapy skills accessible to so many people who might otherwise never get traditional therapy. It's a powerful idea.
Definitely powerful.
Mm.
But as always with research, we need to talk about the limitations, right? No study is perfect.
Absolutely. And the researchers were upfront about this. One key thing to keep in mind is that participants knew which intervention they were getting. They weren't blinded.
Oh, okay. So if you knew you were getting the real therapy app versus just health tips, that might influence how you feel or report symptoms.
Exactly. It could introduce what's called performance bias. It's a common challenge in therapy research because, well, you can't really hide what kind of therapies someone is getting.
Right.
Though the study design with all those different intervention arms and multiple controls was partly an attempt to minimize that bias as much as possible.
Okay.
What else? Another point is that all the outcomes, depression scores, anxiety, sleep, were self-reported by the participants.
Meaning it relies on people accurately assessing and reporting their own symptoms.
Correct. There's always a possibility of assessment bias, maybe people wanting to show improvement, for example. However, it's also worth noting that some research suggests self-ratings often yield more conservative estimates of effect sizes compared to clinician ratings, so it might not necessarily inflate the results.
Interesting nuance. Anything else about the study's scope?
Well, the study mainly looked at the effects over 6 weeks and their durability up to 26 weeks. We still need more research to understand the truly long-term impact, years down the line.
Makes sense. Effects might fade or they might strengthen. We don't know yet.
Exactly. Also, the app focused specifically on those 5 cognitive behavioral therapy skills we discussed.
Right. Behavioral activation, cognitive restructuring, problem solving, assertion, and sleep therapy.
Yes. It didn't include other potentially helpful techniques like, say, relaxation exercises, mindfulness, or acceptance-based approaches.
Why did they choose those 5 specifically?
The researchers picked skills with strong existing empirical support behind them. And interestingly, they noted that some other techniques, like certain types of relaxation, have actually shown potential for negative effects in some other studies. So they stuck with well-established positive ones.
Okay, a deliberate choice based on evidence.
And one more point about the skill. Remember how learning 2 skills is better long-term, but maybe not dramatically better, right, at 6 weeks?
Yeah.
The researchers suggested that at 6 weeks, the effects might not be purely additive. There might be some general, non-specific benefits just from engaging in any active treatment, which could slightly obscure the difference between 1 versus 2 skills initially. But over time, the benefit of having more tools in the toolbox, so to speak, seemed to emerge.
So the interaction between skills is complex.
Yes, definitely an area needing more research, how different skills complement or maybe even interfere with each other.
And finally, who is in this study? Does it apply to everyone?
Crucial point. This study was conducted in Japan with Japanese adults experiencing subthreshold depression.
Okay.
So we need to be cautious about automatically assuming these results will be identical in, say, teenagers or people with diagnosed major depressive disorder, or individuals from very different cultural backgrounds. Generalizability needs further study.
Right. And also whether these results hold up for other apps teaching similar skills or for these skills taught by a human therapist.
Exactly. More research is needed to confirm the findings across different populations, delivery methods, and cultural contexts.
Okay, so acknowledging those limitations, what did the researchers themselves see as the main contributions or expert takeaways from their work?
Well, they emphasize that this study provides really strong direct evidence for the specific effectiveness of individual cognitive behavioral therapy skills, tested rigorously in a large trial.
So moving beyond just saying CBT works to saying this specific part of CBT works for this symptom.
Precisely. Much previous research looked at CBT as a whole package. Breaking it down like this helps us understand the active ingredients, which can then inform how we design better, maybe more efficient therapies in the future.
Does this relate to that idea in therapy research? The dodo bird verdict.
Ah, yes, exactly. The dodo bird verdict is the idea from Alice in Wonderland that everybody has won and all must have prizes, meaning many different therapies seem roughly equally effective.
Right. But these findings kind of challenge that. By showing that different skills had different levels of effectiveness for different symptoms, like the sleep therapy being best for insomnia, it suggests that maybe not all therapies or all components are equal for all problems. Specificity matters.
Interesting. A challenge to a long-held idea.
hmm They also highlighted the value of the research method itself, that master protocol design.
The 4 studies in one approach.
Yeah, they pointed out how efficient it is for psychotherapy research, allowing multiple questions to be answered simultaneously using shared control groups. Saves time, saves resources. They suggest it could be a model for future research in the field. Smart. Any other insights from comparing those control groups?
Yes, an important one. They observed that the waiting list control group seemed to make the app look more effective compared to when it was compared against the more active controls, like the Health Info app or the Self-Check app.
So just being on a waiting list makes the actual treatment look better by comparison.
It appears so, which means that maybe some previous studies using only waiting list controls might have overestimated treatment effects. This suggests using active controls is really important for getting a more realistic picture of effectiveness.
That has big implications for interpreting past research and designing future trials.
Huge implications, yeah. And finally, just circling back to the long-term effects.
The fact that benefits lasted even when app use dropped off.
Right. They really underscored that this suggests genuine learning. The app wasn't just a temporary crutch, it seemed to successfully teach coping skills that people internalized and continued to use.
That feels like the ultimate goal of therapy, doesn't it? Learning skills you can use yourself.
Absolutely. Facilitating that kind of lasting change.
Okay, this has been incredibly insightful, so bringing it back to the listener, what's the call to action here?
Well, while this specific resilient app might not be available to you directly right now, the study really validates the approach.
So explore what is available.
Exactly. Consider looking into other scientifically backed mental health apps, or even just freely available online resources that teach cognitive behavioral principles.
And maybe reflect on those 5 skills we talked about.
Definitely. Think about behavioral activation, adding positive activities. Think about cognitive restructuring, challenging negative thoughts, problem solving, assertion, improving sleep.
Which of those areas feels most relevant to you listening right now?
Right. Could focusing on one of those make a difference in your own well-being? This deep dive really offers a compelling glimpse into how technology could become a much more proactive partner in supporting our mental health.
Okay, so let's try and summarize the key takeaway from all this.
I think the core message is that this large, well-conducted study provides strong evidence that a smartphone app delivering fundamental cognitive behavioral therapy skills can significantly reduce symptoms of subthreshold depression, but also anxiety and insomnia.
It offers a path towards support that's scalable, can reach lots of people, and potentially personalized too.
Exactly, a very promising development.
So, to leave you with something to think about, as these digital mental health tools get more and more sophisticated and maybe more integrated into our healthcare and daily lives, how might our whole understanding of therapy and self-care change in the future?
Yeah, it's a big question. What role could these technologies play, not just for individuals, but in building a more resilient, mentally healthy society overall?
Lots to ponder there. A fascinating intersection of technology and well-being.
Thanks for tuning in to the Health Headliner podcast by To Digital. Like and subscribe for more health news and breakthroughs. Stay healthy and informed. See you next time.